EMT Prometric questions and answers. Questions 21 to 40. 21. A common side effect of nitroglycerin is A. Nausea. B. A headache. C. Hypertension. D. Chest discomfort. The answer is B. Headache. 22. As you assess a 56-year-old man, you note that he is pulseless and apneic. As your partner gets the AED from the ambulance, you should A. Obtain a medical history from the wife. B. Place the patient in the recovery position. C. Perform CPR until the AED is ready to use. D. Conduct a detailed examination of the patient. The answer is C. Perform CPR until the AED is ready to use. 23. Prescribed inhalers, such as albuterol, Ventolin, relieve respiratory distress by A. Constricting the bronchioles in the lungs. B. Contracting the smaller airways in the lungs. C. Relaxing the smooth muscle of the bronchioles. D. Dilating the large mainstem bronchi of the airway. The answer is C. Relaxing the smooth muscle of the bronchioles. 24. In a patient with cardiac compromise, you would be least likely to encounter A. Anxiety. B. Dyspnea. C. Headache. D. Chest pain. The answer is C. Headache. 25. When monitoring a patient with a head injury, the most reliable indicator of his or her condition is the A. Pupillary reaction. B. Level of consciousness. C. Systolic blood pressure. D. Rate and depth of breathing. The answer is B. Level of consciousness. 26. A 56-year-old man with a history of cardiac problems reports pain in the upper mid-abdominal area. This region of the abdomen is called the A. Peritoneum. B. Epigastrium. C. Mediastinum. D. Retroperitoneum. The answer is B. Epigastrium. 27. Which of the following mechanisms cause respiratory and circulatory collapse during anaphylactic shock? A. Bronchodilation and vasodilation. B. Bronchodilation and vasoconstriction. C. Bronchoconstriction and vasodilation. D. Bronchoconstriction and vasoconstriction. The answer is C. Bronchoconstriction and vasodilation. 28. In the patient with diabetes, hypoglycemia typically presents with A. Dry skin and a slow onset. B. Dry skin and a rapid onset. C. Clammy skin and a slow onset. D. Clammy skin and a rapid onset. The answer is D. Clammy skin and rapid onset. 29. Which of the following signs would least suggest a diabetic emergency? A. Bradycardia. B. Tachycardia. C. Combativeness. D. Fruity breath odor. The answer is A. Bradycardia. 30. Which of the following patients would be at most risk for suicide? A woman who quit her job for one that pays more. B. A man who is in the midst of losing a significant relationship. C. A man who is planning a family trip, but gets called away to work. D. An EMT who saved a drowning child and receives a lot of media attention. The answer is B. A man who is in the midst of losing a significant relationship. 31. A middle-aged woman has acute shortness of breath and respirations of 30 breath/min. How should you first manage this patient? A. Assess respiratory quality. B. Begin assisting ventilations. C. Apply supplemental oxygen. D. Perform a detailed examination. The answer is A. Assess respiratory quality. 31. To obtain the most reliable assessment of a patient's tidal volume, you should A. Assess for retractions. B. Listen for airway noises. C. Count the respiratory rate. D. Look at the rise of the chest. The answer is D. Look at the rise of the chest. 32. As you are performing CPR on an elderly man, his wife presents you with a do not resuscitate order. Your most appropriate course of action is to A. Ignore the document and continue the CPR. B. Comply with the document and stop CPR. C. Continue CPR until medical control is notified. D. Withhold CPR until medical control validates the order. The answer is C. Continue CPR until medical control is notified. 33. 5-year-old boy complains of pain to the right lower quadrant of his abdomen. Correct assessment of this child's abdomen includes A. Avoiding palpation of the abdomen. B. Palpating the left upper quadrant first. C. Auscultating bowel sounds for 2 minutes. D. Palpating the right lower quadrant first. The answer is B. Palpating the left upper quadrant first. 34. In most states, the EMT-Basic is required to report which of the following occurrences? A. Animal bite. B. Drug overdose. C. Injury to a minor. D. Motor vehicle crash. The answer is A. Animal bite. 35. A set of regulations and ethical considerations that define the extent or limits of an EMT-Basic's job is called A. A duty to act. B. Confidentiality. C. Scope of practice. D. The Medical Practices Act. The answer is C. Scope of practice. 36. A 9-year-old girl was struck by a car while she was crossing the street and is displaying signs of shock. During your assessment, you note a large contusion over the left upper quadrant of her abdomen. Which of the following organs has most likely been injured? A. Liver. B. Kidney. C. Spleen. D. Pancreas. The answer is C. Spleen. 37. The automated external defibrillator, AED, should not be used in patients who A. Are between 1 and 8 years of age. B. Experienced a witnessed cardiac arrest. C. Are apneic and have a weak carotid pulse. D. Have a nitroglycerin patch applied to the skin. The answer is C. Are apneic and have a weak carotid pulse. 38. As you step out of the ambulance at the scene of a nighttime motor vehicle crash on the highway, your immediate concern should be A. Oncoming traffic. B. Whether the car will catch on fire. C. Placing safety flares by the ambulance. D. Quick assessment of the patients in the car. The answer is A. Oncoming traffic. 39. Which of the following actions should be carried out during the initial assessment of an unconscious patient? A. Assessing the skin. B. Palpating the cranium. C. Auscultating the lungs. D. Obtaining a blood pressure. The answer is A. Assessing the skin. 40. You arrive at the scene shortly after a 55-year-old man collapsed. 2 bystanders are performing CPR. The man's wife states that he had cardiac bypass surgery approximately 6 months earlier. There are no signs of trauma. Your first action in the management of this patient should be to A. Attach an AED and analyze the cardiac rhythm. B. Check the effectiveness of the CPR in progress. C. Insert an oropharyngeal airway and continue CPR. D. Stop CPR so you can assess pulse and breathing. The answer is D. Stop CPR so you can assess pulse and breathing.